Well, there's several things because, of course, one of the things, first of all, is creating a proper autism service. Because at the moment, autism is classed in with children's mental health, and I'm not sure that's potentially the right place for it to be. So I know that the team has been working very hard to focus on autism and those sort of areas to try and break them out from the main service. So I think that will be a step change. But also I mentioned there about the various step project that we've brought in, so the 5 stages, and one of those involves public health working with people early on to try and get mental well-being. So it's not about sitting round and waiting for a mental health crisis to happen or for a child to present. We should be doing more about mental health well-being that's involved in the community, that's going out into the schools and actually, providing support on the ground, and that's where the focus needs to be. I know a lot of people say the answer is money, pump more money into the service. I don't think that necessarily does change things, because as you expand capacity, as I've shown there with CAMS, your demand can also expand as well. As an island, we spend roughly around about 9.9% of the health budget on mental health. That compares with 9.5% in the UK, and the global average for governments is just over 2%. So we are spending, in terms of our percentages, more than most other jurisdictions.
Compared to other mental health services, but compared to physical health services, that is a massive minority.
But that's also the other point, because what we need to get to is we need to get to a step change where mental health is as important as physical health, and combining the two up. The department's already taken steps in that regard by creating the new division this year as well. So we have now a joined up community division. So mental health isn't just a separate entity within the department. It now forms part of a wider division which allows more joined up working.
So when you say, yes, we need to get out in the community more, we need to focus on early intervention rather than waiting for crisis points. I'm sure lots of people will be agreeing with that. How are we doing that?
And like I say, the STEP project is a massive part of that. And also the education programmes that will be going on in schools as well, and with young children around mental well-being and how important it is. I attended on the 9th of October the first ever Global Ministerial Summit down in London on mental health. And one of the key things that was put across there is that early intervention is the key. And one of the things in the next financial year that I want to focus on within the department is not just early intervention in mental health, but early intervention in things across the department. I think that's got to be a theme for next year.
I did some sums, which isn't my strong point, but I had a go. With the numbers I've been given from CAMS, from any age up to 18, obviously most of that will be between 10 and 18, but using the numbers from under 18s, 5.9% of the island's under 18s are using CAMS open cases.
Right, well, I need to clarify that because, of course, one of the things you've got to remember is, as I said before, autism and other sort of conditions such as that are included within those numbers. So whereas you look at the headline figures, it sounds exceptionally scary that you're saying 5% of all children are in CAMS.
5.9.
Or they're not necessarily in there for what a lot of people out there would see as mental health problems. So we need to get better as well in defining what people are in there. So for instance, mental health with children is tiered. So you've got the tier 1 that basically is those that are suicidal risks, all the way down to behavioural problems. Now, when you look at the figures and you break them out by the tiers, it gives a very different picture to the headline picture.
Fair enough. In England, the NHS reported secondary mental health, learning disabilities and autism services, so bringing in all the things you just mentioned. The number of 18s using those services in England is 4.5%.
Yeah.
So, yes, they might be including parts of services that may not be well suited there. Autism services shouldn't fit there, but those numbers are included in the Isle of Man and in England. That's still 1.5% above England.
But also don't forget as well, history shows, and if you look at other small jurisdictions as well, there's a lot of cases that are more easily identified and referred in. In larger jurisdictions, you tend to find they go further towards crisis point before the child presents. So like I say, we've got to get a better idea as to why children are presenting and the reasons behind that. So for instance, one of the things that has driven our referral rate is CAMS previously and some other jurisdictions only take children's mental health up to 16. there was a decision made a few years ago to, quite rightly I think, to extend CAMHS up to the age of 18. So that has obviously driven the referral rate up as well, because there's several jurisdictions that still focus on the 16. So anyone who's 16 to 18 will class into the adult mental health. And I don't think personally that's right. I think we've taken the correct approach by including those figures in the children's.